Welcome to the Synergy Advantage, a 2-in-1 laser system to make your practice more efficient and profitable. Synergy treats a complete range of vascular conditions, from unwanted veins to port wine stain birthmarks and sun-damaged skin. By combining two optimal wavelengths, a high-powered pulse dye laser and a 1064 nanometer long-pulse ND YAG all in one unit, we have increased the versatility of the system. Furthermore, the multiplex option provides a new approach to these treatments.
And that's where you combine these wavelengths. There's a beauty to it. You appear to generate a little bit of clot or methemoglobin with the first pulse. The second pulse has increased and enhanced absorption to the remaining target chromophore, and you get not only the efficacy, you get the depth of damage that's useful. And again, this spares the epidermis and superficial dermis, so you don't see scarring.
The groundbreaking Synergy with Multiplex enables sequential emission of the pulse dye laser and the ND YAG laser from the same delivery system. The time delay between the delivery of wavelengths is easily customized to suit specific applications. The multiplex vascular approach allows the emission on the PDL wavelength in subpurpuric doses. The PDL heats the blood, converting hemoglobin to methemoglobin and clot. This change in the blood increases its absorption of the YAG laser 3 to 5 times, reducing the amount of YAG laser energy required to successfully treat the vessel. The YAG pulse follows a time delay, which is selected based on blood flow rate. The YAG pulse delivery causes coagulation and vessel destruction. The benefits of multiplex include greater depth of penetration, increased safety by requiring less fluents, increased efficacy, and the ability to treat previously untreatable lesions.
And I think we've clearly demonstrated that with our paper that we presented at the American Society of Laser Medicine Surgery. We showed great efficacy with one treatment. In days gone by, when we used to use 0.5 millisecond pulse dye lasers, everybody left the office with bruised for 2 weeks. Now what we're able to do is we're able to get them so they can leave the office with a slight degree of redness.
Cynosure's unparalleled multiplex technology allows physicians to develop patient-specific treatment options for improved outcomes. Prior to all treatments, patient preparation is essential. The patient must be clean-shaven and all makeup, creams, and lotions must be removed. During treatments, the clinician and patient must wear appropriate protective eyewear. Always pre-cool the area prior to treatment. The optional use of clear gel will increase the cooling effect. Skin cooling must also be used during all treatments to reduce heat buildup in treated tissues. And aggressive air cooling or ice packs are recommended post-treatment. Let's begin by showing facial vein treatments using the Synergy Multiplex mode.
If we're talking about parameters for facial vessels, most vessels typically are smaller, that is under 6 millimeters, in which case I'm using a 7 millimeter spot, dye fluences of about 7 to 8 joules at 10 milliseconds, YAG fluences at 40 to 50 joules, 15 milliseconds with a short interpulse delay. Blood is flowing quickly, the short interpulse delay is most appropriate in that setting, in my opinion.
What you're looking for is just a little intravascular clot. That's really ideal. So the idea is if you get the vessels clotted and it stays clotted, you're going to get a much more successful treatment. Now what we found with this is when we used this combination synergy mode, what we achieved was a much better resolution in 1 to 2 treatments than we did with the dye laser alone. And again, this is all about efficacy, shorter treatments.
We've been doing photo rejuvenation with these platforms for years, dye and YAG alone.
But now, multiplex provides the potential for advanced photo rejuvenation treatments. This unique capability makes the Synergy with Multiplex the premier vascular tool for any practice.
If you have small rooms and you have a busy practice, you can't have devices all over the place. I think you have to have a compact unit.
The new Synergy platform also offers the advantage of using each of the wavelengths independently for specific treatments. For example, the high-powered ND YAG is ideal for treating larger vascular lesions. Now, let's get back to multiplex, which is also effective for treating port wine stains and leg veins.
If you're trying to look at advantages of the multiplex over dye alone and YAG alone, there are some key differences. When you're using dye alone, you really are limited with your depth of penetration. Even with multiple pulses or pulse stacking or multipassing, again, you only go a certain depth of injury. And again, some of our vessels are just beyond that. The other thing is with the YAG alone, multiple pulsing, multiple passing sometimes can give you runaway coagulation and some dangerous scarring that could be disastrous if you're doing a laser treatment. So if you're able to combine both, you get the best of both wavelengths, combine them together, and get better absorption with better depth of penetration. It's really a win-win situation.
Rick was born with a port wine stain birthmark covering much of his face.
Dr. Tenghetti's been working with me trying to reduce it, and actually it's gone probably about 50%, I would say, down the amount of redness.
As you can see, after just 3 treatments, the nodules have diminished significantly.
What you're looking for in a port wine stain is typically a small clot developing in some of the vessels, and what you'll see is a slight darkening in those areas. And if you have a little bleb, you can see a little black speck develop in the lesion. That's a very good endpoint. You're trying to avoid graying or tanning of the tissue that indicates charring, and that's really too much fluence. So what you're trying to see is gradual, slow lightening. You're not going to see typically one treatment lightnings with these kind of lesions.
What we're going to use today is a combination of 2 settings. We're going to use the dye fluence at 10 joules, 40 milliseconds with a 10 millimeter spot, followed by YAG, 50 joules with 40 millisecond pulse duration. Again, the delay is going to be extended because the blebs are large pools of blood that sometimes take a little time in between the pulses to cool. Parameters for leg veins are very similar to where our facial treatments are. You can use the short to medium interpulse intervals, that is with the multiplex. If you're using the dye laser, it'd be 10 milliseconds, 7 to 8 joules. YAG, 15 milliseconds, 40 to 60 joules. And again, I prefer using short interpulse delays, but medium would be appropriate as well. If you're dealing with blood vessels over 0.6 millimeters, you're typically using 20 to 40 millisecond pulse durations with both wavelengths. Energies with dye anywhere from 9 to 11 joules. YAG, 40 to 60 joules with short to medium interpulse delay. The idea is either to have the vessel coagulate or disappear completely. Prefer to see coagulation because that often ensures a more complete response.
I think like a lot of things in life, you have to develop a comfort zone with whatever device you're used to using. And what I'm trying to do is also develop comfort and safety. And I think that when you're treating vessels, it makes sense to try to get into safe, reproducible fluence where you don't have trouble. And I think multiplexing really gives you that. The limitations before is the only way you could better treat a lesion was to go up in your fluence. Here we can kind of keep our fluences lower, bring the safety in, and increase the efficacy without compromising our patient's appearance.
Synergy with Multiplex, changing the way of treating vascular lesions. For more information, please contact Sinosure at 1-800-886-2966 or visit us on the web at www.sinosure.com.